Aspiration therapy is a new weight loss solution for people with obesity. This newly FDA-approved device allows you to aspirate 30% of your consumed calories into the toilet. The process is simple and discreet, so no one needs to know.
The procedure is performed in a standard endoscopy suite under sedation. Once the patient is asleep, they're laid flat on their back and an endoscope is inserted through the mouth. It is passed through the esophagus into the stomach. Once in the stomach, a light is shone, and that light is usually visible on the skin surface. Once that's seen, a little tract is created between the skin surface and the inside of the stomach. A wire is then passed through this tract and grasped and then removed from your mouth. Once this happens, the aspiration tube or A tube is inserted onto the wire and then it is reinserted into the mouth. It is gently pulled through the esophagus and stomach and then exits the stomach itself. Once the tube is in a secure position, we re-inspect endoscopically and then we secure the tube on the skin surface. Then the tube is gently cut and secured in position. The procedure normally takes anywhere between 15 to 20 minutes. It's extremely safe and there's very little pain associated with it.
To begin aspiration, the system is removed from its carry bag. The reservoir is filled with normal drinking water and the lanyard is placed around the neck. The system is connected to a small, discrete skin port on the skin, which connects to the tube in the stomach. When the lever is rotated, the stomach contents begin to empty into the toilet. When the flow stops, you want to close the clamp and then squeeze the reservoir bag. This infuses water directly into the stomach to help loosen the food particles. Emptying starts again once the clamp is closed. This process can be repeated until the draining stops and about a third of the food is removed from the stomach. The rest of the meal is digested normally for a gradual, healthy weight loss. In total, the aspiration process takes about 5 to 10 minutes.
So in studies performed in the United States, it's been shown that patients can expect to lose approximately 15 to 20% of their total body weight at approximately 1 year. There have been some studies which have looked at patients who have used the device for more than 1 year, and in fact in those studies, not only do patients seem to keep that weight off, but they might lose a little bit more weight as well.
At the Concierge Weight Loss Program at Johns Hopkins, we recommend that you keep the device in for at least 1 year. However, it is intended for long-term use and many patients have kept it for longer. There are some patients that have kept it for multiple years.
So the exciting thing about aspiration therapy is the fact that it's suitable for many patients. It's useful for those patients who have high BMIs, i.e. those above 35. It's also useful for patients who've had prior gastric surgery and even those who suffer quite significant reflux. Aspiration therapy is an excellent method to keep weight off long term. It's important that you implement the lifestyle and diet modifications that you learn whilst you have the aspiration device in place. For example, learning to eat more slowly and drink more water during a meal, as well as chewing your food very well and avoiding snacking between meals are all excellent lifestyle modifications. With the help of our Comprehensive Weight Management Centre, we can help you achieve these very important lifestyle and diet changes so that you can keep weight off long term.